Rosemary Prince. I had to look at her name tag because none of us are what we all call each other, but her official title here is practice manager. Anybody have any idea what that means?
She's working to be a manager.
She's practicing to be a manager. That's what it sounds like, isn't it? You need another what? Paper? Oh, we can get her one. Okay. But anyway, Rosemary actually manages what is better known as our clinic over there where Dr. Jane, Dr. Dahl, Dr. Katrina. Does that tell y'all she's got her hands full right there just with those three names? Can you imagine keeping up with what all those people do, making sure everybody does the right thing and in a timely manner? She does a great job. So we appreciate her coming over in the middle of her day to be with us here because she's going to talk to us about the Medicare Wellness Program. Isn't that right, Rosemary? Is that what we're discussing today? So I know she has some great information, something we all need to know. So here she is.
Thank y'all very much for having me, and I usually have a big enough mouth that I don't have to use the microphone, so I may walk away from it. If you can't hear me, let me know. I gave y'all several handouts. Probably the most important thing that I want to make sure everybody has is this little card right here. It says medication record, but it's a little bit more than that. And if there's one thing that you get out of the little talk today is that you need to take charge of your own health. I've been in healthcare and been a nurse that's worked at the hospital and in the physician practice, and I have about 30 years of experience, maybe a little bit more, but I really didn't want to say that. So I've seen a big change in healthcare since I started working in the healthcare field, and I'm sure you guys have too. It used to be that it was left up to your doctor to tell you what you needed and what you didn't need, and ordering tests for you, and that has changed over the years. I'm sure when you go to the doctor now, you usually go for specific. I have a sore throat, I have an earache, my knee hurts, I fell and hurt my arm, or whatever it may be. And a lot of times the doctor's addressing those problems that you're going for. And not many people go anymore just for a general physical. Probably 90% of the population that's over the age of 65 has high blood pressure, high cholesterol, diabetes, asthma, other types of disorders, and the doctor concentrates on treating those problems as opposed to just a general physical. So that's what we wanted to talk about today. Is the new, it's fairly new. Last year they had certain guidelines for Medicare wellness. This year they've added a few more things. So I kind of wanted to go over those and make sure that everybody knew that if you have Medicare Part B, and does everybody know what Medicare Part B is? You have A and B. A covers hospital charges and B covers the physician charges. And pretty much everybody has A and B. So as long as you have Medicare Part B, you're eligible to have a free, and you can see my little button that I have. All my staff wears these little buttons. You're entitled to have a free Medicare wellness exam yearly. And that's a fairly new thing. You used to could have new to Medicare, as everybody that's become eligible for Medicare had a new to Medicare exam. And that's more like a general physical that includes an EKG, that type of thing. But the yearly wellness exam is for anybody that has Part B for longer than 12 months. Because if it's before 12 months, then you do the new to Medicare. Anything after 12 months is you have the yearly wellness exam. And this exam is a little bit different than your usual exam. It's more of a time for you to go in. The doctor's going to review your medications. And we have some new little pamphlets at my office that we just ordered that are real similar to this. But you'll see that one whole side of this is about your medicines. Back when I first started into nursing, and up until just a few years ago, when you went to the drugstore and you had your prescription filled, the doctor wrote you a prescription for Lanoxin or medicine like that. They put Lanoxin on there and they put what it was for. It was for your heart. Now, when I look at medicine bottles. They put all the different generic names on there. They do not put what the name of what it's for. So you may go to the drugstore this month and you may get something filled for your cholesterol that has one name on it. And when you go back to get your refill 3 months later, they may put another generic name on there. And if you're not smart enough to know what it's for, sometimes you might end up with two of the same medicines, but you don't know it because you don't know what you're taking it for. So if you already know the name of your medicines and what you take it for, take this little card and fill it out and keep it in your pocket. It's designed so that men can slip it in their wallets, ladies can put it in their purses, you can put it in your pocket, but you should always keep it with you. It's got a lot of important information on here. And a lot of times people don't think that the things that they take over the counter are important, but those are very important medicines too. Sometimes you may be taking vitamins, or you may be taking an aspirin and your doctor wants to put you on another medicine that maybe thins your blood a little bit, and so it's important to put all the prescriptions and over-the-counter medicines on here and to put what you're taking them for. And if you don't know, next time you go to the doctor, take your bag of medicines with you and ask the nurse to write them down for you and what you're taking them for. We do this all the time at my office. Because it is very important that you know what you're taking and what you're taking it for.
How about if you have minor insurance?
Ma'am?
What way we can have minor insurance to place with Medicare? Same thing.
Like Humana and all the others. Yes, ma'am. The only difference is, and I just want to stress that there are so many of the HMO Medicares out there now. A few of them may charge a small copay when you go for your wellness exam, but it's still supposed to be covered free of charge. I haven't seen anyone that has had to pay for that free exam yet, but I guess that when you look up the information on the Medicare website, it does tell you that there are a few of the plans that could possibly charge you a copay. But that's one of the really important things too that I want to stress about the Medicare wellness. Right now, I know with it being the first of the year, most people have to meet a deductible. This Medicare wellness exam does not fall under your deductible. It's completely 100% free of charge. You don't pay a copay, you don't pay your deductible. You go in and you have an exam with your doctor. And it's more of a counseling session. You're going to have your blood pressure and your temperature and your pulse and your oxygen level checked. You're going to have your height and your weight and something that's called a BMI. Does anybody know what a BMI is? Very good, very good. You're going to have your vision checked. How often have you been to the doctor lately that they just did a general vision exam? So your vision is checked with that, whether you wear glasses or not. It's still just a screening just to see if it's been any changes in your vision. And I'm going to just kind of briefly go over what happens during the exam, and then we'll talk about some other things too. When we schedule, and all doctors' offices are a little bit different, but the exam should include the same thing regardless of where you go to the doctor. When we schedule a patient for the wellness exam at our office, we give them a form to take home with them to fill out, because a portion of the exam falls under the patient's history. We want to know all your medical history. So it's a little place on here for you to fill out a medical history so the doctor can review it. Family history. You know, if you've been going to the same doctor for a long, long time, and when you first started going there and they got your family history, that's probably buried down in your chart somewhere, and they may not have reviewed it recently. And things may have changed over the years. So we ask that you fill out a family history. We also want to know all the doctors are you going to. Going to a cardiologist? Are you going to an arthritis doctor? Are you going to an orthopedic? Because that's important too. They may have prescribed medicines for you. We may not have them listed in your chart. We want to know all the medicines and all the doctors that you may be seeing. And then there's also on this form something similar to what's in your little card that I gave you, and that's just a list of all your medicines that you're taking, whether they be prescription drugs or whether they're over the counter. And then we got this long medical history questionnaire, but it's very simple. It's just basically, do you have changes in your weight or your appetite? Do Do you have any feelings of feeling tired or sleepy at times? Do you have any problems with your eyes or your ears or hearing? Just kind of little basic things, and it's just a yes or no that you can circle. And then, do you have problems that you need to be addressed? Have you had a fall? Does your home have adequate lighting? Do you have handrails on your steps? Do you need help with the telephone, transportation, shopping, preparing your meals? Sometimes these are things that you never remember to even talk to your doctor about. So this is a way for us to kind of review all that with you. Another thing that's very important, do you have a living will or the healthcare power of attorney advance directive? I'm sure y'all have already had a talk on advance directives, so you know what I'm talking about with that, right? Okay, so that's one portion of it. This is the patient's portion, the medical history. You're going to bring that back with you when you come for your exam. When you come in for your exam, you're going to, like I said, you're going to get your weight checked, your height checked, your BMI, temperature, blood pressure, pulse, your oxygen saturation, and you're going to have a mini mental status exam. Has any of y'all ever had that before? Do you know what I'm talking about with that? It's just real basic, and I'm going to tell you a few of the things that's included in that. The doctor's going to ask you, do you know today's date or the day of the week? Do you know where you are? Are you at the doctor's office? Are you at the hospital? And they'll ask you to name 3 objects. They're going to tell you, like at the beginning of the exam, like one of the exams that we use is the 3 things are ball, flag, and tree. And then you'll continue with the exam, and then at the end of the exam, the doctor will say, do you remember the first 3 things that we talked about, the 3 objects? And then you have to recall those objects. They may ask you to count backwards by 7, starting at 100, which to me that seems a little difficult. I would really have to stop and think about that. Or they may ask you to spell the word world backwards. That's another one of the things. That's also a little bit difficult too, but then this is just a little mini mental status exam. They may point to their watch and say, do you know what this is? Or they may pick up an ink pen or pencil and say, do you know what this is? Let's see. And then another thing is they'll hand you a piece of paper and ask you to fold it, maybe in fours or in a triangle shape. They will ask you to close your eyes, and they may hand you a pencil to see if you know what it is. Ask you to draw on a piece of paper, like a square, and have them connect with each other. And then they score that. And it depends on which kind of test they use. There's several of these little mini mental status exams that are out there, and each doctor kind of has their own little preference. But those are kind of the basic things. And they score it, and if you score within so many points of being the perfect score, then everything is considered fine. Or they may think you maybe have just a little bit of mental deficits, and that's something that they probably would just keep a check on. And remember, with the Alzheimer's drugs and the dementia drugs, the earlier you start on them, the better, and the longer that can prevent further deterioration of your memory. So that's one of the reasons that they do this. The other, things that they're going to talk to you about are your advance directives. They're going to check and see about your vision, make sure that there was no visual problems. The nurse will be the one that does a little screening. They're going to update your medicine list. They're going to update any allergies. They're going to talk to you about if you smoke. They are going to do like a little depression screening. The depression screening is kind of like the little mini mental status exam. There's a lot of different ones that you can use. They're going to basically ask you just a few little questions like, do you have a sense of sadness? Dissatisfaction with life? Do you feel guilty about things? Do you have self-dislike? Have episodes of crying, irritability, insomnia, fatigue, anorexia, weight loss, weight gain? Some people, when they're depressed, eat more, so they gain weight. Some eat less and they lose weight. So those are just some basic things. But those are all included in your wellness exam. Then, after all that is done, they're going to go over some of these preventative services. I gave y'all a copy of it. It's on a yellow piece of paper. The preventative services and what you're entitled to. That's free under Medicare also. Do all of y'all know what's included in your with Medicare? I'm sure if you, I don't know if everybody gets a booklet every year that changes. Do y'all get a booklet or now?
I didn't get mine.
Okay. I know a lot of places have changed and you have to go online to look at them, but and the handouts that I gave you, you know, you can go to Medicare.gov and you can look up all these things too. They also have on their website a place that you can actually go in and you can key in your preventative medicine. Say when you had your last mammogram or when you had your last cholesterol check, and you can actually keep it logged there if you would like to. But the doctors are going to go over all the preventative things on this list, and they're going to schedule you for things that they feel like you're high risk at with. And we're going to go over those in just a minute. And then lastly, they're going to go over healthy living recommendations, which this is an important part of the Medicare wellness. They're going to talk to you about physical activity. The recommendations right now are at a minimum, all adults should exercise at least 30 minutes, 5 days a week. So that's what the healthy guidelines are. Weight and healthy diet. Fruits, vegetables, whole grains, fat-free, low-fat dairy products are the healthy choices. Lean meats, poultry, fish, beans, eggs, and nuts are good. Try to eat low in saturated fats, low trans fats, low cholesterol, low salt, and low added sugars. Try to stay at a healthy weight by balancing your calories along with what you burn for your physical activities. Alcohol, if you do drink alcohol, you're supposed to limit that to a safe level. Men and women that are over the age of 65 should have no more than one drink per day. And an alcoholic drink is defined as 12 ounces of beer, 5 ounces of wine, 1.5 or a shot of 80 proof distilled spirits or liquor, like gin, vodka, whiskey. Tobacco, of course, we all know that causes cancer, stroke, heart disease, and lung disease. So, of course, the recommendation is for you to quit. And that's also part of your preventative medicine. Aspirin, 81 milligrams a day is recommended for men ages 45 to 79 and women ages 55 to 79, unless there's a contraindication like if you've had a bleeding ulcer or that type of thing. So those are just kind of the healthy guidelines. And we're going to go over these preventative services. The first one is, like I said, that's on your yellow piece of paper. And then I also gave you the other handout is one that you can actually keep a list if you don't want to go online and document when you had it last. It's a preventative services checklist. The first thing is the abdominal aortic aneurysm screening. And this is a one-time screening of an ultrasound for people at risk. Now, with a lot of government things, this is a little bit confusing. We were confused at the office, so I'm going to tell you what I found out about that. The screening is the doctor talking to you, basically. We can't send everybody over to the hospital to have an ultrasound done to see if you have an aortic aneurysm. What Medicare says is free is the screening part. So the doctor's going to ask you if you have a risk factor. Do you have a family member that has had an abdominal aortic aneurysm? Or if you are a man ages 65 to 75 who has smoked at least 100 cigarettes in his lifetime. That's another risk factor. Or if you've ever had a screening ultrasound done before that showed you had a small aneurysm, then of course Medicare will cover for you to have one yearly. So those are your screenings for the abdominal aortic aneurysm. The other one is the alcohol misuse counseling. This is a new screen that I think that this year is the first year that Medicare is covering that. You can have a once per year screening, and that's you talking to your physician about how much you drink, what you drink, and if the physician feels that you need to have some counseling, Medicare will pay for you to have 4 face-to-face sessions per year. So that's for the alcohol misuse. The bone mass measurement, that is a bone density. I'm sure most of you have had one of those done. Medicare pays for one every 24 months. Now, if you've had breaks and you've had a prior bone density that said you were at high risk and you're on medication for it, Medicare will pay for it more often than that. But every 24 months is the average. Cardiovascular screening is another one that the government doesn't really make very easy to understand. They will cover for a total cholesterol, the HDL and LDL and triglycerides once every 5 years, which I thought, well, that was a little strange. But that is if you have a normal cholesterol, always had a normal cholesterol, then the only time that Medicare will pay for it 100% is if you don't have anything every 5 years, never had high cholesterol. That doesn't happen very often. But that is a free service for you to have the initial screening done for that. Colorectal cancer screening, there are several parts to that. You can have the fecal occult blood test, that's once a year. That's the little take-home packs, if you've been given those. Sometimes when you go for your physical exam, you'll have the rectal exam. The doctor will do the little fecal exam screening in the office. Then you have the flexible sigmoidoscopy, and you have the screening colonoscopy and barium enema. The most common right now, of course, is the colonoscopy, because you just pick up a lot more when you have the colonoscopy done. And Medicare will pay for one every 120 months if everything is normal. If you go and have your initial screening done, the Medicare covers, everything comes back completely normal, they'll pay for another one, that's 5 years. If you are at high risk, every 24 to 48 months they'll cover. Depends on what your doctor, usually the doctor will recommend, if they find a polyp and it comes back after the biopsy, comes back that could be like pre-malignant, then Medicare, of course, will cover it every 24 to 48 months, depending on what the doctor says. The barium enema is another way. There's some patients that just refuse to have colonoscopies done. They don't want to have a colonoscopy, and they opt for the barium enema. That's not done that often anymore because the colonoscopy is considered such a safe procedure, but that is something that you can have in place of a colonoscopy. It would be better to have a barium enema or the flexible sigmoidoscopy if you absolutely refuse to have a colonoscopy done. All right, let's see. Your next screening is the depression screening, which we kind of talked about, and Medicare does cover that every 12 months. That's included with your Medicare wellness visits. The next one is the diabetes screenings and diabetes self-management training, and you've got that listed there on your paper. It really depends on whether you have pre-diabetes. Some people come in and they have high blood sugars, but they're not really diagnosed with diabetes. You probably would be sent over for some nutrition management here at the hospital. The dietitian does that. And we also have, I don't know how many of y'all have taken advantage of that, but they have the little diabetes luncheons. Is it, how often, Tracy? I don't know how often they do them.
We have the diabetic education class
Every month? Okay. So if you are diabetic, you should take advantage of that because they have a lot of good information with that. If you have a written order from your doctor that you need the diabetes management, that's usually with somebody that's going to help you use the blood sugar monitors, and the nutrition and exercise. Medicare does cover that also. Of course, the flu shot is covered yearly. Glaucoma test is yearly. Hepatitis shots are covered if you are considered to be at risk. And these would be people that have like kidney disease, or they have other, types of liver disorders and that type of thing. And that would be by recommendation by your physician. That's a series of 3 shots. HIV screenings, if you're at risk. Yearly mammograms are still covered by Medicare. The medical nutrition therapy, like I said, for diabetes. Your pap smears and pelvic exams are covered every 2 years. The welcome to Medicare, we're going to talk about briefly. Well, we already talked about it a little bit, but that's a little different than the Medicare wellness. The pneumonia vaccine is every 5 years. If you've not had a pneumonia vaccine, you probably need to talk to your doctor about that. It's usually recommended for everybody that's over the age of 65. Prostate cancer screening, that includes the PSA, the lab work, and the digital rectal exam. That's covered every 12 months. And then the smoking cessation counseling is covered. Also, 8 face-to-face encounters per year with your physician. It's covered by Medicare. So, tell me what kind of questions that you have so that I can try to
Going back to
answer.
the colonoscopy, I've heard that after you get a certain age that they don't do it. What is the age then that they stop doing it?
It really depends on the individual, because you might have somebody. They used to say 85. After the age of 85, you don't need it anymore. But it really depends on what you've had prior experience.
If you're not, then you don't have to go.
If you've had a couple colonoscopies, like every 5 years, like that's recommended, and you've always had a negative one, and you don't want to have another one, then I think that's perfectly fine not to have another one. Yes, ma'am.
Does Medicare cover anything as far as dentist or mouth care?
No, ma'am, it does not. That is something that probably needs to be added. I mean, if I got to go to Washington and made that suggestion, I would. The 3 things that were added new for this year with this plan, the Medicare Wellness Plan, were the alcohol misuse, the depression, and then the obesity and the medical nutrition counseling. But I think dental definitely needs to be added in there.
Okay, thank you.
I wish there was covered, but it's not right now.
How about the shingles vaccine?
The shingles vaccine is not covered by just general Medicare, but if you have some of the Medicare drug plans, yes, if you have some of the drug plans, what we usually have to do with that is it has to be ordered through your pharmacy, and it would be one of your pharmacy benefits. So you would go to the drugstore and pick it up and bring it to the doctor's office, and we would give it to you. But it's not with all the plans. It's just so many out there now. It's just not a cut and dry thing anymore. We used to could tell you exactly what was covered and what wasn't, but so many of the HMOs, and then some people have medicine plans that cover certain things but not preventative things. So it's just a lot of them out there. But we can always check it for you. We can call your plan and say she wants to get her shingles vaccine. Most of the time, most everybody that I've seen is covered through their pharmacy benefit. But not everybody has that, so.
I checked into it the other day because I didn't want me to have it.
Uh-huh.
But the amount of insurance was going to cost me $80.
Okay.
They called the insurance company.
Right, and a lot of y'all that do have the pharmacy benefits, you have somewhat of a deductible at the beginning of the year too, so it may be higher. Yes, ma'am.
How effective is the shot?
It's, from what I understand, it's very effective. I don't know what the percentage rate is, but it's pretty high. Don't know the
I
actual
got
number.
shot and I got shot.
Really? Well, you're just very unique then.
You had the shot.
Does everybody understand the difference between new to Medicare and Medicare Wellness? New to Medicare is a one-time thing within the 12 months of becoming eligible for Medicare. Medicare Wellness is new. It is 100% reimbursed by Medicare and it's yearly. And everybody should have a Medicare Wellness exam. So if you haven't had one, now's a good time to go and get it. How many times do y'all go to the doctor and they sit down and they talk to you about all these things that I told you was included in that exam? You have to ask for your Medicare. Well, at my office we don't because we wear the buttons around all the time. And we try to promote the Medicare Wellness, but you may have to ask and say, I want to have my Medicare Wellness exam the next time I come. And it's once a year. It doesn't mean that, say if you were in the office today and you were there for a sick visit or you were there for a follow-up with your high blood pressure, your cholesterol, whatever, you can come back tomorrow and you can have your Medicare Wellness exam. It's two totally different things. And right now is a good time of year to have it because, like I said, you don't have to pay anything. You do not have to meet your deductible for that. But then you can't go and get everything else done too. You can't.
So this Medicare Wellness exam should be completely separate from any other doctor's visit that you do. Is that what I'm hearing?
That's exactly right. Yes. They're going to sit down and go over what your needs are, what might need to be scheduled. And if you're a woman and you haven't had a mammogram in a couple of years, don't wait for your doctor to say, oh, it's time for your mammogram. Please get your mammograms every year. And there's other health things, other issues that, that we talked about today. If you feel like you have a problem with smoking, if you feel like you might have a problem with depression, talk to your doctor about it. Because there's right now a national shortage of primary care physicians or family doctors. And the way that all of us have known medicine to be in the past is not happening anymore. And the shorter they get, the busier they get, and you have to be in charge of your health. You need to be in charge of your health care. And you need to remember that you need to get yearly mammograms. You need to have your pap smear every 2 to 3 years. Those are your colonoscopy. You just need to keep up with those things. So hopefully the little card I gave you will help a little bit. And if you don't know when you had your last mammogram, I had someone in my family that had a strong family history of breast cancer and went 5 years without having a mammogram. And she said, well, the doctor didn't tell me I needed one. Don't let the doctor be the one that tells you what you need. I mean, they do need to tell you what you need, but you also need to take your own health in your hands and try to, keep up with when you had it. And I myself, I have a hard time remembering. Time goes by so fast. So if you have a question about it, you don't know when you had one last, call your doctor and ask them, when was my last mammogram? When was my last pap smear? Write it on your little book. You got space that you can add some other things on here. Write it on there and keep up with it. They can tell you, the hospital here, if you had your mammogram done here, it's as simple as pulling it up on the computer and looking and saying, oh, well, you haven't had a mammogram for 3 years. So it's very easy to find out. Your doctor's office can look it up for you. The hospital's more than happy to look it up for you. Back in radiology, they'd be glad to tell you when that was. Any other questions? Yes, ma'am?
Is there an age limit on mammograms?
No, ma'am.
Okay, they should keep getting those as long as there's something.
Right now, it's been some controversy about mammograms. It's been some controversy about the prostate, the PSA, but right now there's not been any changes that have been made in that.
What is the radiation risk? The cumulative radiation?
Little to none. You get a very small amount of radiation.
Compared to the risk of not having it.
And you see more of your breast cancers in people that have not had a mammogram done in a long time. because they can find such small, minute things that are easily treated. You know, now we have the digital mammography, which picks up things even quicker. And I know Dr. Hogg has been over to talk to y'all, what, twice maybe? And since he's been here, we have found, and he's keeping kind of a log. He has had almost like a 90% positive rate of the things that he's biopsied, which is extremely high. It should only be around 45 to 50% positive of somebody that has an abnormal mammogram. So what that kind of tells us is that we're not getting enough patients that are having mammograms done, which is really scary. And if you do not have insurance, or if you know people that do not have insurance, the health department here in Emporia does offer free mammograms here at our facility. They fill out like a little voucher. You have to go to your doctor, and you still need to have your breast exam done, and they need to write an order for you to have a mammogram, but you can go to the health department, and I think it's on Tuesdays, and they'll do a screen and verify that you do not have insurance and that you would have difficulty paying to have a mammogram done, and they will give you a voucher to get your mammogram done. So I know that probably doesn't apply to people in this room, but if you do have children, friends, neighbors, people you go to church with, keep that in mind. And then during the month of October, of course, during Breast Cancer Awareness Month, the hospital offers, I don't think it's free, but it's at like a minimum cost.
Usually they try to offer no cost to the patient, which means if they have insurance, they'll still charge the insurance.
Right, that's right.
They'll take care of what's left over. And those are good for not just the month of October. We give them out during that month, but they're good for a year to bring them in.
So in other words, it's no reason to not have your mammograms done. But if you have a question, about the Medicare wellness, don't hesitate to ask, your physician. All the doctors are, aware of this. This is something that Medicare put out. This is part of the Obama's health care plan, the Medicare wellness card, which it's an excellent opportunity for you, like I said, to go to the doctor and have a chance where they're not just focusing on listening to your heart or listening to your lungs. They're sitting down talking to you about what you need to have done, and some of your concerns. A time to basically talk and to get a plan of care together. Anything else? I put the handouts over there in the little card, so if you need to take an extra one for spouse, friend, family member, help yourself.